second panelist is Dr. SABU, and all of you know him, and I will leave it with the colleague here to introduce you. But I just want to add one more thing. I need to mention that I got close to SABU last 1 year. I had an opportunity to get closer to him during the white paper session, as well during the IFHIMA conference. What I came to know is the amount of work as an academician he contributes to the HIIM profession. I'm not sure how many of you know what he has done, but just to make it a point, he contributed to the development of HIIM curriculum for Indian career, for Indian HIIM professionals. So which is one of the key things. And further, even with IFHIMA, he coordinated in developing the HIIM competency. So what my point is to SABU, I take this time to appreciate you and your initiative. And my request to you is please expand it to the next level and to the next states.
Professor SABU KM is currently the Associate Dean of the School of Allied Health Sciences and Professor of Health Information Management at Manipal Academy of Higher Education, India. He is currently serving as an executive member in the Global Advisory Council for Healthcare Workforce and a member of International Task Force for Tiger.
I think the background looks I am going to perform something extravagant. It's no. Okay. Good afternoon to everyone. So I take this opportunity to thank Lorraine and IFHIMA to be part of this privacy panel. And it was a wonderful time we had for almost 8 months or so. So when we talk healthcare and privacy in the Indian context, it's very challenging because the ecosystem where we function in India is slightly different from many other countries. As we all know, we will be now seeing the different kind of healthcare systems in India, which we have the modern medicine and traditional system of medicine, that is Ayush, Ayurveda, Yoga, Unani, Siddha, and Homeopathy. So you look at the statistics of the various agencies, around 10 to 15% of Indian population go and access healthcare service from the non-traditional setting, that is other than the modern medicine settings. So you can understand the complexity of maintaining the healthcare privacy or the privacy related to the health information of a patient. So many times we assume that health information privacy comes only when you manage or handle the medical records of patient or within the 4 walls of medical record department. No, it is beyond that. So I'll be taking that context in Indian context to all of you. So you might be able to understand what is the complexity of healthcare privacy and how each one of you might play a role in ensuring the healthcare privacy in different healthcare systems. So we have a lot of challenges. I'm not able to tell the clear solutions. We have very eminent people amongst us, and maybe you also have to find out solutions for various challenges when you start working in different healthcare systems. As we know, we are moving to the digital health platform. So large-scale integration of information technology in healthcare. So that is also posing a challenge to maintain the healthcare privacy. Then the next one is widespread of electronic medical record adoption happening. And you know what all the importance and relevance of maintaining the healthcare privacy while the sharing of information in an electronic platform and those things. And one of the very important legislative act which we have is Right to Information Act, which was enacted in 2005. So I don't know whether it is a good or bad, because many times people misuse this RTI because they think that if they file an RTI, you can get any information. So there are not the times where the patient information also sought by filing RTIs. So it is very challenging because patients or as a citizen, their information can be gained through RTI. So it is important that the clinicians, the administrators and information officers should know what is the legal entities of RTI Act, especially with releasing the information about patient, whether it is adding to the breach of healthcare privacy or the privacy of their information. So that is something which we have to consider. So we usually use a term called fiduciary relationship. That is the relationship which you maintain with the patient and the healthcare providers. So the patient come and trust the healthcare providers that his or her information is pretty safe under them. So that is a complex situation. Maybe you have to look into those aspects. Then there are various complex legal and regulatory frameworks, which I'll be showing some of that. So if you look at the statutory councils, which provides on the ethics related to various aspects of healthcare management, so they also clearly indicate there is a need to maintain the healthcare privacy. So if you look at the two very important councils which in India, that is Medical Council of India and Dental Council of India. So they have very clearly told that the protection of healthcare data is very important. So any healthcare provider, so which includes even the health information or medical record personnels who manage with the health information, should maintain the privacy during and after the patient care. So don't think that it is only when the patient is in the hospital you have to maintain privacy. Even they leave the portals of hospitals, it is the responsibility of you professionals to maintain the privacy. And even they very clearly say the code of ethics for the professionals on maintaining the healthcare privacy, and even you cannot release the information without the consent of patient. Then another very important council, which is Indian Nursing Council. So they also very clearly state that the information should be maintained through informed consent and maintain anonymity in using such information for any kind of activities. For example, like you might use data for quality assurance, academic purpose, and day-to-day routine management of your system. So whenever you come across such situation, you don't think that you can simply use all the patient identifiable information as you want. There are concerns of privacy. And even for digital data purpose, it has to be protected. All the personal records should be, the access should be very well determined. Only the authorized persons should be able to access the information even in digital platform. So what is the context of healthcare privacy? So don't think that it is just emerged in last 1 decade or 2 decades. If you look at 1897, the first one of the very old act, which is called as Epidemic Disease Act. So that Epidemic Disease Act very clearly states that if there is a patient come with or reported with a disease which is going to be a threat to the community. So recently you all are scared of coronavirus. So we have received a lot of calls that whether is it safe to come to Kerala to attend this conference because of corona threat. So when a person is identified with corona virus, assume that situation, and you might see that person's details in social media, even in the other media channels and all those things, people start revealing the personal identification. See, actually it is a protective measure which governments tell that the government should have an access of such information of epidemic disease. But it is at the point of government level to highly maintain the privacy and use it for the government purpose. Should not be revealed or the media should not be used. So there are a lot of concerns come with those Epidemic Disease Act. The other very important is 1987 Mental Health Care Act, which is recently amended in 2017. So which very clearly tell the right to confidentiality and right to access the patient basic medical records. So many times the mentally challenged patients may not in a situation to clearly give authority to whom the information can be released and all. So there are a lot of mismanagement you might happen or you might come across when especially with the healthcare privacy. So you have to be very careful when especially you handle the information related to the mental health cases. Other one is 1971 Medical Termination of Pregnancy Act, MTP. So which clearly states that on certain situations, the medical termination of pregnancy is allowed. So there are some cases where, I want to highlight one case where in Mumbai it has happened. So there is a lady which she already have a child with Down syndrome, and the next child, the second child, also diagnosed with Down syndrome. And that lady approached the High Court to get a medical termination of pregnancy. So there it becomes a big news. Media start covering about this lady. So much of sympathy to the lady. So how she will manage the second child, even born with Down syndrome. So then it was like a celebration with the media and all, with passing this information about this family, her details. So there somehow we failed to protect the privacy of that patient. So it is just the health problem of that person. And he has approached legally to get some benefit out of that. But it has gone to a level that it has come in media, it has come in newspapers. People start identifying that person with that family and all. So then it is a concern. So it has to be very sure that this kind of information should not reveal to media or other people. The other one is 1994 Fetal Sex Selection. That is PCP and DT Act, so which very clearly say that the information related to the gender of the fetus, male or female, and those related privacy has to be maintained. In 2001, the Health Insurance Act, IRDA, so which also tells very clearly about different privacy aspects when the information is managed for health insurance purpose. I'm sure many of you people are involved with health insurance processing, or somehow you might give information or you might sharing the information with health insurance agencies. So please make sure that even though it is a health insurance company, you have certain roles to make sure the privacy of the patient is protected. So because it might reach to many people and the information can be misused. So you have to be very thorough and understandable about what all the privacy context which describes in the IRDA. And the other one is 2006, which talks about the Rights of Person with Disability Act, that is amended in 2016. So if a person with disability go to any government office to access some benefits of disability, say they ask a lot of information, the personal information, his health status information and all, and it will pass from one desk to many other several desks, and everybody will come to know what all his health problems, what all his family background and all those things. So are we now concerned about the privacy of that person, because he want to avail some benefits and he has to buy legally, he has to produce a lot of information about his health deficiencies and other things or family status. So is it right to reveal all this information, or whether we have to think whether this act has to be relooked, whether we should collect all this personal information to give some benefits. So again, the people managed with disability certificates and providing information or collecting information has to be very clear about what kind of privacy has to be managed. So there's all this context which talks about the patient rights to privacy. So many times we presume that all the acts or laws are not applicable to HIIM profession. It is with the administrators or medical superintendent or the clinician. No, we also have to have a clear idea on this context. So many times the privacy breaches happens because of our ignorance or wrong interpretation of law and the act. So it is your responsibility to understand or interpret these laws and legality of these privacy acts or the different legal acts and make sure the privacy is not misused. So what are the game changes which India is looking forward? So you all know about there are certain standards have evolved in last 1 decade. That is, one is the Electronic Health Record Standards 2012, which clearly talks about the privacy standards along with the security standards, which is available online, which also covers the basic guideline to safeguard data privacy, especially when you manage the health information in an electronic platform. So I would request all the HIIM professionals, so one of the objective of this session is to educate especially the students or the new HIIM professionals to make sure that you are thorough with, or you should understand what all the privacy aspects which is mentioned in the Electronic Health Record Standards. The other one is the proposed Digital Information Security in Healthcare Act, DISHA. It is something which has been evolved on the background of GDPR Act, which is enacted in Europe. But yesterday I heard from Dr. Sushil that it is, even though it was a draft which is available on the public, now government is trying to come out with a new set of healthcare privacy, especially with the digital information security. So this has formed a background for that, so which clearly talks about the various right to privacy and how you are going to handle the sensitive health related information, how you are going to manage the personally identifiable information, and when the data or the information is transferred or shared or transmitted in a digital platform, what all the things you have to address on the privacy. Then of course, one of the very important thing is education and awareness program. So this is a kind of education and awareness program, this conference. So I'm sure we have to create, or we have to educate our professionals or our students about the relevance of healthcare privacy. Because GDPR is a game changer which is going to transform the healthcare privacy across globe. Even though it is only applicable in European Union, but any entity which is working outside Europe also has to strictly follow the GDPR guidelines. So for example, in India, we have a lot of European companies work in healthcare system. They manage EMR or so many other interoperable systems. So even medical tourism, when a patient from Europe come to medical tourism to India, so it is the responsibility of that hospital to ensure their privacy acts are as par with the GDPR. So it is going to be very relevant and very important for even in Indian healthcare context. So if it is not as per the GDPR, the European Council or the countries which are not going to approve those hospitals for the medical tourism. So that is one scenario. So we have to create this kind of education and awareness on. These are the few scenarios which I want to just highlight. There are a lot of scenarios which you might come across. How the privacy breaches happens in India. So one of the cases in 1992 was Nihara Life Insurance Corporation. So the privacy breach details, you can see the disclosure of menstrual cycle, consumption, pregnancy by the woman applicant at the time of joining a Life Insurance Corporation of India. So is it adding to the privacy of that person? So Supreme Court ordered the corporation to delete such details from the application. So there are scenarios where the court has to intervene and protect the privacy of information. So that means our system is not efficient to tackle all these privacy aspects. Another case in 1996 between Raghunath Rajaya and Maharashtra Medical Council. So a patient relative demanded the patient medication records from the hospital, and unfortunately Bombay High Court made it mandatory hospital to furnish the case sheet of the patient to his or her relative. So its judgment fails to provide any rights to healthcare facility to protect the healthcare privacy breach. In this case, the hospital was actually denying that information which the patient relative was asking, but that relative went to court and maybe the Right to Information Act or some, the provisions they use, and they got a favorable verdict from the Mumbai High Court, so that the hospital has forced to give those information even though the patient doesn't want to give that information. Other case, very interesting case, which in 2003, husband demand for the medical examination about the virginity of his wife to prove consummation of marriage. So then the Haryana High Court, the Punjab and Haryana High Court clearly said that the hospital or the you cannot, the person cannot ask somebody even though he is going to marry that lady to all those information. It is act of violation of right to privacy and dismiss the case. So you might see the cases or the legal system which sometimes very favorable to protect the healthcare privacy, but sometimes you might see they use the legal loopholes and you might see the violations of privacy of patients. So with this, I'm ending my session, and I think next speaker will continue. Thank you, one and all.